welcome to the first pitch session of the day. Thanks all for being here. I'll be introducing the companies in a minute, but just first a reminder of the format for the session. Each company will be pitching for 5 minutes, and then we'll have 5 minutes of a Q&A. And for all the investors in the audience, just a reminder that you can write any questions in the chat box during the pitch, and you're more than welcome to turn on your cameras and interact with the companies during the Q&A. So we have first Nikolai Thompson from the UK at Jukes, and Jukes' mission is to empower a world where all athletes can access sports, and I cannot wait to hear more about it. Thanks.
Thank you, Anna. Thank you so much for having me. I'm just sharing my screen now. Okay, so can you confirm you can see everything okay?
Yeah.
Wonderful, wonderful. Well, thank you so much for having me in Barcelona. Jukes is a hardware company with a mission, as you say, to empower all people to participate in sports for mental and physical well-being, then go on to do extraordinary things. I know Jukes is a good fit if you believe in our mission and are looking for a high-impact investment with a solid return in this growing wearable space. So what do we do? This is Lincoln. He is deaf and he has been a keen swimmer for 2 years. In October 2019, his club bought headsets so Lincoln can hear the coach's instruction at the same time as everybody else. The first time he did, his mother was on poolside and was in tears. This is possible because we have waterproofed bone conduction speakers, and using radio, we can transmit audio up to 750 meters away. To date, we have focused on the swimming market and can be found everywhere from COVID-19 PTSD recovery programs to a European national team training with Jukes for the Tokyo Olympic Games. So pick your sport. Is it swimming, triathlon, sailing, surfing, rowing, football? There are so many challenges to learning and becoming great at a sport, but this is the one Jukes solves for. We know a lack of real-time communication mean fewer coaching minutes each session, resulting in slower improvement and dwindling passion when you're not winning. Our solution is a radio-enabled headset training system to put coaches and supporters in real-time contact with athletes on land or in water to give them the encouragement, technical and strategic guidance they need to achieve their goals and do extraordinary things. So this is the headset we currently source from China, and it has got us this far. The specs are no longer innovative, but we are helping coaches and athletes get closer. And on social media, from amateur clubs in New Zealand through to clubs across the UK, there's a lot of chatter on Instagram. And Dr. Gary Palmer, who is now using Jukes to increase the fitness of international athletes from triathlon to football. So we've done amazing things with clubs around the world, with our 14th country just added. The bulk of our business is in the UK, which was recently given a boost with a commercial deal signed with the Swim Teachers Association, allowing us to offer our tech exclusively to their 12,500 members and 56 member countries around the world, including massive sports markets in the US, Australia, and China. But this is our future for Lincoln and the tens of millions of athletes between 8 and 80. An innovative headset for multidiscipline sports above and below the water with IoT connectivity, lightweight sensors, and a breakthrough adjustable fitting for all heads in all sports. This is what your investment will bring to life and be sold to the $16 billion sports coaching market that sits inside the hugely exciting $450 billion sports market full of potential acquirers. I am also very proud to announce that as of Monday of this week, Jukes has been accepted to Loughborough University's Advanced Technology and Innovation Centre, giving us access to their vast research and sports resources and EU funding to bring manufacturing back to the EU continent. The idea of real-time communication in a sports coaching environment is actually quite novel. And 100% of our 1,200 sales are from word-of-mouth recommendations and customers posting on social media. Unlike our most interesting competitor, Milo, who has spent 3 years designing their walkie-talkie replacement and yet to release a product, or Finis and Zygo, who designed a product first and are now trying to sell it. You are investing in a team that have learnt a lot in the past 3 years about what a great sports headset needs to be to break out beyond a single sport with eyes on the prize, football. So today we have a simple business model, selling through our website with payment up front. However, we're signing our first dealer in Amsterdam, and we've just started trialing an option to pay 40% up front and split 60% of the balance over 12 months for purchases over 5K. This is hugely promising, as we've seen those original order values double already. My team is small but effective, and for those interested in getting to know us, we look forward to meeting you when restrictions allow. Here, I want to highlight the resiliency this business has shown, considering sales during 3 UK lockdowns went to almost zero. We have continued to grow with the numbers in the grey box split by quarter. Our gross margin is an average of 41% and our operating margin is 26%. And forecasts for the next 2 years will be discussed with interested investors. So this is our ask. We are asking for £275,000, offering a 20% discount on a convertible note, which will be transacted through Seed Legals. We are also submitting our second bid for up to £225,000 from Innovate UK to further develop software-defined radio. After all, I come from telecommunications, and software-defined networking revolutionized the industry. Thank you so much for listening. I welcome your questions. Thank you.
Thank you very much, Nikolai, for that amazing pitch. I was wondering, in the meantime, can you explain a little more how the tech works? And before you answer, just a reminder that anyone can use the sort of question chat box to ask any questions, or just feel free to ask questions and turn on your camera.
Yeah, absolutely. So this headset and a couple of other models that we've just started selling has got a radio receiver built into the end of it. It uses FM radio in a range which is below the typical commercial radio. There is also a radio transmitter at the other end, which linked to a microphone is how a coach speaks to whoever is wearing this headset. And we have seen some really interesting use cases, really. There's a lot of people who are climbing mountains at the moment, probably not right now, but using Jukes and hearing instructions. There are world record attempts to swim around the island of Jersey, for instance, and they're all wearing Jukes headsets for safety reasons. So there's some very interesting, not just sport applications here.
Okay, that makes a lot of sense. And would it be, of course, Francesca, do you have any questions?
Hi, and first, congratulations. I think it's a really exciting offering. Have you considered including virtual coaches as well, so that patients can train and have their coaches be present wherever they are in the world?
Yeah, Francesca, that's a really good question. So there's two parts to that answer. Yes, we have considered it. The current technology is not up to it, though, hence part of the reason for the refresh. So the new headset, it's going to be essentially connected in real time to the internet. And so you would be able to have a coach based anywhere in the world deliver either live or pre-recorded. And so the pre-recorded option does work for an awful lot of sports where it's time-based. So someone can literally just record where you should be if you are trying to achieve ABC, and obviously access to superstar coaches is then possible for anybody around the world.
It could be an interesting business model too, a sort of coach franchise approach. Thank you.
Yeah, it is. It is. And it's almost that there is an opportunity to become a bit of a peloton of several other sports where it's very difficult to communicate in real time.
Absolutely. Thanks.
Thank you.
I think we have time for one more question, if anyone is keen to ask. Otherwise, in the meantime, I may ask then, would it be possible to use it, for example, if I was cycling with a friend or my partner or whoever, would it be possible to communicate between each other using those headsets?
So not at the moment, but the headset that's being redesigned is going to be a full duplex headset, which means that there's a microphone inside each headset so that you can communicate with each other. So yes, but in the next iteration. You'll still be able to benefit from about a 600-meter gap between each other, even with that limitation.
That's wonderful. Well, thank you very much for your presentation, Itai. And in the interest of time, I'm going to move on to the next presentation, which is going to be presented by Edward Lynch from Life in the UK. And Life gives people access to an ecosystem of resources designed to nourish the health of our body, head, and heart. So the stage is yours, Edward. Thank you.
Thank you very much. Good afternoon, everybody. It's a pleasure to be here. I hope you can understand my Liverpudlian accent. It's a little city in the northwest of England. I will share my screen now. Okay, I hope you can all see this.
Yes, we can see the presentation.
Yep. Okay, great. Yeah, like I say, good afternoon. My name's Ed. I'm one of the co-founders of our company called Life. And we're a team of doctors and health tech experts changing the way individuals and corporates approach their health. And we're doing this by creating the very first complete online wellness social platform. And you can see some screenshots of the app there. But let's jump into the problem that we're solving. So in the UK and mostly across Europe, we focus on our health from a negative standpoint. And what that means is we wait for something to go wrong and then we try and treat it. So we wait for somebody to go into hospital or to approach their general practitioner with problems, and then we try and fix it. Bad outcomes for the patient. It's very it's very cost ineffective, and it's a loss for both parties, really. What we need to do, and this is the future of health, is that we focus on our health from a positive standpoint, where we are every single day doing little things to improve our well-being and our overall health. That is why our field of lifestyle medicine and wellness is one of the fastest growing markets in the world. So what current solutions are there? Well, there's an absolute myriad of solutions that currently exist out there. If you want to book a fitness class, or if you want to have fitness things at home, you can go onto Peloton. If you want to track your well-being, there's Evergreen Health. If you want to track your calories, there's MyFitnessPal. There's Instagram. If you want to look at healthy partners available to you around you, like your local favorite brands, if you want to watch their content. There's various other apps. You might use Google. You might be Googling problems, which is a whole issue in itself. You might download apps such as Headspace or Calm or Strava. You might download Deliveroo if you want to look at healthy things around you. And look, this goes on and on and on. It's exhausting, frankly. And based on the fact that the average user downloads 0 apps per month, this is not a sustainable solution. And that is exactly why we created Life. We give you all of the resources that you need in one place to live that healthy lifestyle. And it's all backed by medical evidence as well. So the information you're getting is correct and true. So some of the features here, it's on the left there, it's highly personalized to you. There's 8 key categories within the platform that you need to do, medically backed, to look after your health. And we can see what things you're doing and what things you aren't doing and push your activities based on that. It's geolocated, so you can see, 200 yards down the road, there's some healthy food that you can get, again, vetted by ourselves. You can book your favorite classes. You can look at health and wellbeing products. It's a complete ecosystem for your health, and it's never been created before. And this works for 3 reasons. Well, it's massively convenient. It's the biggest trend since the 1920s. We want things faster. We want things right now. It's highly personalized. And also, the one thing that brings you back to every app is a social aspect. If you think of the biggest apps in the world, Facebook, Instagram, Twitter, LinkedIn, YouTube, they all have some kind of social aspect to them. Look, we're tribe animals, essentially. We're not actually evolved to live in the world that we live. We are tribal animals, and that is what brings you back to an app. And that is exactly what we've distilled into Life. Okay, now I want you to put your corporate hats on. Yoga Sita, they're one of our healthy retailers who sit within the platform. They push their healthy products within the platform. They actually have, so Lucita, the founder from Spain, funnily enough, she has similar issues to our users. She's having to use all these different platforms to push her content, to push her products and services. It's really, really exhausting for her. And she doesn't actually know if she's getting any return for it. She doesn't know where her target markets are. It's an absolute logistical nightmare. And she spends £350 a month on this, which is extortionate. That's why we created the retailer portal for Yogacita, where she can do everything that she needs to do in one place, and it is much cheaper. She can get breakdowns and reports to see which users are most highly engaged, and then she can tailor her content around that. She absolutely loves the platform. Our feedback so far has been overwhelmingly positive, and that's why we have over 15,000 users waiting to use the platform. Our scaling plan sits with these 8 key areas that I mentioned earlier. These are medically proven to improve your health, and we acquire retailers in each of these areas and scale from city to city. The market is vast. In the UK alone, it's worth 13 billion, and it grows yearly on average 19%. Glowfox is our closest competitor. They have 0.11% share of the market. Last year turned over 18.4 million, and since their conception, they've raised 33 million. Our revenue streams are simple but vast. On the left-hand side there, we've got a B2B subscription and a B2C subscription. That's in-app revenue streams. The things on the right-hand side are outside of the app, but encompasses the entire business. But we'll keep it simple and keep to the subscriptions for the app stuff here. So we've had a £100,000 grant, so we've managed to keep all of our equity, which is great, along with some EU funding on top of that as well. And we've been recently recognised as a tech climber within the northwest of England, one of the fastest growing health tech startups in the UK. We produced this roadmap as a part of that project, and up until the end of May, we've hit every single target that we've needed to do. So as a team, we're highly effective. Although small, we can deliver on everything that we set out to do. So it's me and Toby at the top there. We're the founders. We're both doctors. And then Rich, Jonathan, and Joe underneath. They have mixed experience across the UK and European, advising on a European and UK level. And the CTO of massive global brands there as well. So, a team small but highly effective. Now we're looking for £150,000 of SEIS. We're fully accredited to achieve a really solid product market fit before scaling. And I'll leave you with this quote. What LinkedIn is to your profession is what life is to your health. Thank you very much for listening, and I welcome any questions.
Thank you very much, Edward. A great presentation and a great and very interesting product. I might get it myself. A reminder that if the investors want to switch on their cameras and just ask questions or put them on the chat box. In the meantime, I wanted to ask you, have you seen, I'm assuming that you can. Actually, go Pilar. You can ask the question first.
Hi, congratulations on the presentation.
Thank you.
Health and community is a hot subject. And my question would be, if I were an investor, is on the scaling up. I do understand the concepts on the business model, but to be well orchestrated. So how are you going to scale on a geographical perspective?
I think you cut out there briefly. Sorry, was that? It might be my connection. Was your question around how are we scaling?
Geographically.
Yeah. So what we do is we are just Liverpool based at the moment, but we link into the corporate markets. There's a massive well-being need within the corporate setting. Corporates have big corporate social responsibility budgets that are unspent, and we go in there and we set up deals with those corporates beforehand to show that we have the users in that area. That's exactly what we've done in Liverpool, and we've shown the demand is there for the people, and then we approach the retailers and say, look, these are the people that want it. If you put yourselves on there, we can put you in front of them. And then with that kind of arrangement, the retailers like, absolutely get me onto the platform, because then we're just giving them essentially business really, really simply. We link up with local councils as well. So one of the best methods that we've used in Liverpool is using the combined authority in Liverpool, so the council and the governing bodies, including the chambers of commerce, to actually get those retailers on board as well, and using big network companies. And then we'll copy and paste the same ethos across city to city.
Thank you.
Okay.
And in the meantime, before we get another question, I was just going to ask, I would be interested to know if you can gather data of the ROI also for the, I was going to say patients, but I guess consumers, in terms of how much benefit can they see, not only in terms of sort of physical, but also well-being and the likes, and that way you can sort of link the ROI also for them?
Yeah, absolutely. So within the platform, there is, it's called the Warwick Edinburgh Mental Wellbeing Scale. So it's the most highly validated tool of wellbeing in the world. And we've incorporated that into the platform. The more that you engage with it, the more the app learns about you, and the more accurate that ROI would be. But I think we're doing a real world validation study as well with one of the universities in Liverpool to work out exactly what you've mentioned there, because until we have enough data, we just won't know. So that's why, around 6 months ago, we started this piece of work, but it's a 2-year project, and, I don't know the results of that. I can't give you an answer today. But it's a great question. It's something that we've considered previously, and we want to do that exactly. So the NHS is one of our big targets, and if we can say to them, for X amount of money, we produce these outcomes, that gives us a much stronger standpoint. So.
No, that makes a lot of sense. And 2 more questions, maybe, if nobody else has a question. I was going to ask, what is the pricing for the consumers?
So it's a freemium based model. So if for the end user, they go on and they can see everything in the platform, but they get limited access to it. So all of the things which we class as basic, they get access to. So actually seeing the retailers, engaging with the retailers, and using so many offers, or watching so many bits of content, or booking so many classes, that's all free. Once you do 4 activities with that retailer, if you want to do more, then you pay £1 a month. But £1 a month. The money comes in more from the retailers. So for that essentially online retail space, if you like, for that retailer, we charge them for that.
Thank you.
Where the bulk of them is.
That makes sense. Thank you, Edward. Pilar, did you have another question?
No, but I think there is a question from the chat, from Jerry Craig.
Oh yeah, of course. I actually cannot see it. Pilar, do you mind reading it for me?
Basically, I think it's addressed to you. So how are you measuring the effectiveness of the application? But I think you already answered. But if you want to shed some light on that, yeah?
Yeah. So it's similar. It's similar to the question that was asked a minute ago around the well-being scale. So we have the well-being scale, and we can look at. Look, one of the problems is with people's health is we get a snapshot in time, and there's no follow-up. So what the app actually does is, the more that you engage with the questionnaire, there's notifications when you get asked about the wellbeing scale. The more that you engage with it, the more discounts the app pushes to you. So you can essentially save more money by incentivizing them to go to this wellbeing scale. So we can track users' wellbeing over a period of time. So that's one. But secondly, it's a piece of research that we're doing with the university to check out essentially, the ROI of individuals based on the amount they spend. But I don't know the outcome of that study because it's not finished yet. It's in like stage 1 trial. So I'll have to get back to you on that one.
Well, thank you very much, Edward. That was fascinating. And in the interest of time, I'm just going to move on to the next company. But thank you so much.
Brilliant. Thank you. Thank you all.
So next on the stage is Moises Barbara Ramos from Drill Surgeries, in a mixture of UK and Spain, funnily enough. And Drill Surgeries is developing medical devices that guide surgeons during intramedullary nailing surgeries. The stage is yours, Moises. Thank you.
Thanks a lot, Anna, for the introduction. And just before start, please let me know if you can see my screen.
Yes, I can see your screen.
Yes. Lovely. Well, let's start, as always, from the beginning. Hello and welcome to Drill Surgeries, a startup working to improve healthcare through technology. And to do so, we move one step at a time. First, focusing on a common type of surgery, intramedullary nailing surgeries, aimed at assisting the welding of broken bones in femur, tibia, or humerus. This surgery is performed over 200 times a year per hospital in the UK, and of course, so around the world. In this surgery, what is known as an intramedullary nail or rod is inserted inside the patient's bone to assist on the welding. Now, the issue is that the current method relies heavily on X-rays, and there is an excess of radiation shot at both patients and surgeons. Now, the technique used is what's known as a trial and error method, which proves to be inaccurate and time-consuming, meaning there are risks derived from blood loss and long-time anesthetics. All of this is happening right now in a country spending close to £50 million a year in these surgeries, around £6,000 per patient, where most of the amount comes from the room charges, since patients need to spend close to 10 to 15 days at hospitals post-operation. Our solution, though, already shows potential to reduce hospital admission as it ensures fewer risks during the operation. And if this is true for the UK, and our research goes further than just this country, it is true for our target market, every hospital in the world, because we all know someone, somewhere, who broke their leg or arm at some point in their lives. In over 2 years of research and development, we have seen and spoken with dozens of doctors from Spain, the UK, Switzerland, Australia, etc., that keep preferring the freehand or trial and error techniques on these surgeries rather than relying on mechanical or electromagnetic guiding systems offered by competitors, which are coined as inaccurate. All of them, though, showed an inclination to welcome a new medical device for this surgery. And that is what Drill Surgeries provides, a solution built with the constant input from surgeons and for surgeons. Making use of the latest technologies, our prototype implements augmented reality and tracking algorithms, offering real-time and 360 degrees guidance without the need of radiation, reducing then operating time and risks caused by the more traditional approach. And we are not only offering safer and faster surgeries, but also with fewer risks. Patients stay less time in hospitals, and hence we can also reduce cost per patient, which at 200 surgeries per hospital per year amounts to a substantial quantity. The team making this happen today includes myself, starting the project when I was heavily involved on world-class physics research in Switzerland, a chief medical officer that has performed this same surgery for over 10 years, and Henry, an aerospace engineer that led the development of the fully working prototype that is already showcasing promising results. In the past 2 years, we have received support for the value of over £30,000 from several organizations and institutions. We've been invited to startup incubators, and we've participated in countless startup competitions, including the Santander X Entrepreneur of the Year 2021 competition, where I will personally be pitching at Wembley Stadium in London next October. Finally, We are now looking to raise our first formal round of investment for £150,000 to grow our team, improve the software side of the prototype to satisfy the levels of accuracy we strive for, and start testing the device by Q4 2021 or Q1 2022 on bodies at hospitals we are already in conversations with. Thanks a lot for your time. Thank you.
Thanks a lot for the wonderful presentation, Moises.
Thank you, Anna.
Just a reminder to place your questions on the chat box, or just welcome to turn on your camera and ask directly to Moises any of your questions. Hi, Daniel, do you want to ask any questions?
No, actually, sorry, technical mistake.
Don't worry.
Presentation, but sadly, I only caught the first half of it. I'm terribly sorry. I'm not interrupting.
That's completely fine. Don't worry about it. Maybe I can ask the next question then. I was wondering how do you see the market adoption going forward? Who do you need to sort of convince in order to use this tool?
Well, actually, the way we started this startup, it's not as okay, we identified a problem, now let's try to fix it and then convince our target market. We are actually the ones that got convinced by our target market to start the startup. This was at the time in which I was working in Switzerland, and I had just came back from China, where I did some work on tracking algorithms for automated car driving. And I got approached by a series of surgeons that were experiencing a series of troubles and handicaps performing a very common surgery that they experience every day. Now, they were like, well, the products from the competitors do not do what we need them to do. They are inaccurate. So we spend a lot of time. There's a lot of radiation. Due that you come from a technical background, could you help us with this? So that's how we started. After we got to understand the problem, I was then really keen to know what was happening around the world. That's why I knocked on every door that I found in front of me, and that's how I got into contact with surgeons in Switzerland, Australia, the UK. And I was sharing what some surgeons from Spain and the UK had shared with me. We realized that this happens more often and in every country that we contacted. So we committed to finding a solution. And at the core of our work, we wanted to keep these surgeons that helped us start and the new ones that we contact every month as key partners, let's say, in our process. So that's why our product is not something we develop at the labs with aerospace engineers and scientists, but also something that we developed at the operating theater through conversations with surgeons, etc.
Well, that's the ideal situation, and definitely the smart way to go forward. So thanks, Moises. That makes a lot of sense.
Thank you, Anna.
I'm just going to give a couple more.
But Marcia Rojas Alfonso, she's asking, how do you expect this innovation would help a developing country, and how cost affordable will that be for them? And speaking of cost, my question for you is, why are you only asking for £150,000 or dollars? Because it seems very small for the for the surgical sector. But anyway, you can pick them first, Marcia.
Well, Maritza, that was actually a very nice question, and that's something that we have always been thinking about in terms of how to satisfy the 13 goals of the United Nations for their plan for 2030, as we try to create a better environment for all of us. One of the beauties of the technologies that we work on and that we try to improve every day, it's augmented reality and tracking algorithms. This means that the more we support these technologies, the more we invest in them, the more and more accurate we make them, the cheaper and more affordable they will be, and also the better purpose they will serve. At the moment, one of the problems in developing countries is the lack of materials, the lack of equipment that they can get their hands on to perform some of these surgeries. Now, we move one step at a time. That's why we focus to make the best product for this type of surgery with the input from surgeons. But as we grow further over the years, we can then use the same device to support different types of surgeries. At the end of the day, as we grow and we develop this technology further, we can implement it in developing countries where they will only need a single and simple device to guide them during surgeries without having to rely on 10 different devices for 10 different surgeries, as well as access to 50 million pound X-ray machines, etc. and etc. And just as I was mentioning the thought that we move one step at a time and trying to answer your question, Pilar. So why are we asking just for 150,000 pounds? Well, we like to do things well, we like to do things right, and to not rush into anything. If we had access to 300 or 400,000 pounds for the following 6 months, which is actually the timeline in which we plan to spend this initial investment, we would be falling into the errors that many startups before ours has suffered, which is a huge injection at the beginning, and then a lot of cash gets burned into tasks that do not matter, that are not as urgent as they should be. We have created a plan for the following 6 months in which we have carefully selected the spots in which we need to spend this 150,000 pounds to bring this product, this already working prototype, to the step it deserves, so we can start receiving feedback from international surgeons and start testing it in bodies. As we approach the timeline, the deadline of these 6 months, we then look forward to keep working with our investors to raise our following round and keep working together one step at a time.
That's a great answer, and I hope that answered your question, Pilar. I think in the interest of time, I wanted to thanks again for the speakers for the amazing presentations, and also for the investors for the insightful questions. And I wanted to just say that next on stage we have the panel discussing digital health in Spain and in Barcelona. So I look forward to seeing you all in there.